Swadika, and welcome to Be My Guest, the program which brings you successful stories of entrepreneurs and organizations in both the domestic and international arenas. I'm Sarosha Ratanapian. Alopecia is a common disorder affecting more than half of population worldwide, and only a few drugs right now have been approved so far to treat hair loss, and it's a hair therapy. And also another alternative, it's hair transplantation. In this episode of Be My Guest, we are talking to a researcher and a doctor from Chulalongkorn University, Associate Professor Dr. Rashatan Panjaprateep, who has just guaranteed the first poster award in 2017 from International Society of Hair Restoration Surgery from her research of hair treatment therapy for low-level laser therapy, or LLT. So let's hear more from her. And right now I'm granted the opportunity with Associate Professor Dr. Rashatan Panjaprateep from the Division of Dermatology, Department of Medicine, Chulalongkorn University. Swadika.
Swadika.
So first of all, I guess our fans of Be My Guest would like to know more about you. So could you introduce yourself a bit?
Actually, I'm working here in Chulalongkorn University. I'm a dermatologist. We are graduated, and then we're studying more on the dermatosurgery. So mostly I do dermatosurgery, laser, and then I went to study in US about the hair restoration surgery and about the hair disorder. So after I graduated, I'm working for most of my work is focused on the hair disease, hair disorder, and also the hair restoration surgery.
I see. Okay. So the focus of the interview, in this episode is about your research. You would say, okay, that just won the award. Okay. Okay. So could you tell us a bit about your research that just won the award?
The research is about the mechanism of the low-level laser therapy for the treatment of the androgenetic alopecia. Firstly, I would like to briefly about the androgenetic alopecia to all of you. The androgenetic alopecia actually is the most common cause of the hair loss in the world. I mean, in many men and many women in the world. This disease is very difficult to treat because it's caused by the genetics and the male's hormones. So that's why many doctors, many research try to find out the treatment for the androgenetic alopecia. Actually, the low-level laser therapy has been used for a while for the treatment of many disease. For example, like we have nerve injury, we have chronic wound that is difficult to heal. Doctor using this light to heal the chronic wound. However, in the field of hair disorder, this was introduced for the hairs since 2010. So we are introduced to know that this laser can be used for treating hair. But I myself don't believe that because we actually don't know the mechanism of actions of the low-level laser therapy to treat hair loss. So I decided to do the clinical study in Thai people and also to do what we call the proteomic analysis. That's analyze the protein expression before and after we treated the patients with a low-level laser therapy. But actually, this study has two phases. The first phase is we call the clinical study. So we have totally 20 patients. 10 patients were male and 10 patients were women. So we let the patients, we asked the patient to use this, we call the low-level laser machine at home. The patient was asked to use 25 minutes every other days for the whole 24 weeks. So about 6 months. And then we are taking the photos, we measure the hair count, and then we measure the hair mass index to check the number of hair that changed during 6 months. And the first two study is the study that I received the award. So the first two studies about the mechanism of actions. So we have 5 patients that so very kind to us that allow us to get the biopsy from the scalp at the baseline, and after we treated the patient for totally 24 weeks. So at that time we are isolated the hair from the scalp and then we send out for the proteomic analysis.
Okay.
So it is the first study that proved that there are many proteins that involved in the important process of the hair cells that make the hair cells work better increase after treatment with a low-level laser therapy.
Okay.
So I think this study is important because this study can answer many questions that all dermatologists still questions about the efficacy of the low-level laser therapy for the AGA.
Okay. So we would like to know whether low-level therapy does it really, work, for the patients in the clinical test?
In clinical tests, it's work a lot. In men, we found a totally 45 hair increase per square centimeter. In women, their number is increased up to 21 hairs per square centimeter. I think we can see with the naked eyes that the patient get better after photographies.
Okay. Now that has been the first phase of the study,
Yes.
okay, which is clinical study. Now what about the second phase that you mentioned?
The second phase is we found the important proteins, especially the proteins that we call the extracellular matrix. We call the number of many collagens that important for hair to regrowth increase more significantly after the treatment.
Okay.
We also found that many protein synthesis and many cells energy increases.
Okay. So all in all, so it has been the first phase only that you got the award, or the both phases?
Actually, I got an award for the second phase, the mechanism of actions.
Okay. Mechanism of actions of the treatment of low-level, therapy. Now, what about the reason why, you have got interested, in this study?
Like I already said, this is about androgenetic alopecia. It's the most common cause of the hair loss, and I think it's work on this disease might help a lot of people in the future.
Okay, in the future, right? And what about the, any feedback from maybe from other researchers or maybe from patients? So how did they say about the research here?
From the researchers, actually, this paper was presented in the International Society of Hair Restoration Surgery meetings. This meeting is about annual meetings that every year many doctors that interested in hair disorder, in hair surgery, they come together to renew the knowledge every year. So everyone is interested in this study because everyone have the same questions in their minds.
Okay.
This is where we work, and everyone glad to know their new knowledge about this disease.
Okay, so very positive feedback then.
Yeah.
Okay, so any impacts I would say from the study, maybe from other international researchers in that in that event.
So many doctors believe more that low-level laser therapy might help the patients, and I think in my personal experience, I think low-level laser therapy is quite safe. It's safer than many treatments, and we are now treat patients more with this disease, with this treatment, and we believe that it might work in the patient.
But for now, it's time for a short break. We'll right back. We learn more on the contribution of this treatment to Thai society and to other international arenas, and also how this therapy works. Okay, so don't go away and please stay tuned on Be My Guest. And welcome back to the program. You're watching Be My Guest with me, Sarosha Ratanapian. I'm still with Associate Professor Dr. Rashathon Panjaprateep from the Division of Dermatology, Department of Medicine, Chulalongkorn University. So in this break, we'd like to know more about the award that you just have got from international arena. So what is it?
Actually, these meetings, they are annual meetings of the International Hair Restoration Society. Every year, many doctors from all over the world we come together to have 5-day meetings, full days meetings that have a lot of knowledge about the hair disorder, hair surgery, and we have every year we have a poster award. I mean, every doctor sends their research to get that award. And this year, I'm so lucky that I have the first range of poster awards. Actually, I submit the research to this meeting many years, but only this year that I get the award.
Could you tell us a bit about the events or the activities that are and were ongoing in that day?
The day that I get the award, actually, it is my birthday. So I'm so lucky. This award is like a gift to my birthday. So I present this research as a poster, and then we get the highest. I get the highest score, so I get the first rank of the award.
Okay, so congratulations, okay, for the award, okay, that you just got. Now, can you tell us a bit about the treatment, okay, which is low laser, okay, therapy. So how does the treatment work?
Firstly, actually, this treatment has been introduced for a while since 2010, and these machines was approved as home use devices. That means the patient use this machine at home. They have many range of the machines. Some of them are like combs, some of them is like a helmet, some of them is like a caps. So usually the patient use this cap or this helmet at homes. You can use every other days or you can use every day for usually briefly about 25 to 30 minutes a day. Exposed to the area that you have problem area, the area that you have thinning hair, and then the laser will shine on the hair, the scalp, and we call the mitochondrial. This is organelle in the cells. We absorb this light and working better, make a lot of many proteins synthesis. So it's like stimulate the cells to work better. So it stimulates the hair cells to work better. So make the hair from the smaller size, become thicker at the end.
Okay, and how does the treatment, okay, last? I mean, for how long we should use the helmet or low laser therapy?
When you use this helmet, when you use this machine, after the research, we said that usually you have to need at least 3 months to see the result. 3 months to see the first result, and 6 months to see the full result. After you get a good result, I usually advise the patient to continue to use that, actually for the whole life, because when we get older, our hair is like smaller and falling down every day.
Okay, and any dangerous side effects, okay, from the treatment?
This machine is US FDA clear, like 510K clear. That is mean it's quite safe to use it at home. The one thing that you have to know that you must not point this laser directly to your eyes, because this laser is some kind of diodes. So it may injury to the retina if you directly look at them. But most of the laser in the market right now, they have safety protocol. Like when you remove it from your head, then the light will turn off it automatically. So it is like more safety for the users.
Okay, and any other suggestions? Suppose patients are using a low laser therapy treatment, right? Now, what about the scalp treatments? Okay, such as shampoo or such as how they should treat their scalp. So, any other suggestions on that?
About the low level laser therapy, a little bit more. Actually, I would like to emphasize that this laser treatment usually work on the patient who has only mild to moderate severity of the androgenetic alopecia. So first thing, if the patient want to use this machine, they should come to see the doctors to get a correct diagnosis that they are the androgenetic alopecia. If they have another kinds of hair loss, for example, like alopecia areata. Alopecia areata is the hair loss from the autoimmune diseases, which is not associated with this one. The treatment is totally different. So firstly, you have to get the correct diagnosis from the dermatologist, from the doctors. And then you have to know the severity of the patients, because the patients who work for this one is the patient who have only mild to moderate severity. If you totally bald, this laser may not help.
Okay. And this laser will actually help prevent hair loss as well?
Yeah, it can help to prevent hair loss in the older patients. And in the patients when we get older, the hair starts to lose, and we can use this to prevent or delay the hair loss This might
okay.
help in the senile alopecia.
I see. Okay, so from my prediction at first, so the early age that you get treatment by low laser therapy, the better. Okay,
Yeah.
they will receive the treatment. Was that true?
Of course, early age, the severity of the hair loss is not too bad. You still have many hair on the scalp, but that hair is weaker or that hair is small size. So the level can help the hair from small size to become the bigger size. But if you totally bald at that stage, you need more procedure, like you need hair transplantation surgery. Not only topical or oral might help. It's usually not help.
Oh, I see. Okay, so last question for this break. So, how did you feel? When you got the award? Because you are so successful. In doing your research right now.
So actually, I'm really glad because this research we did totally 3 years, almost 3 years to finish them because we have 2 phases. Since the clinical state phase and the mechanism phase, which the basic science phase is quite difficult to do. It takes us a long time. Actually, we have a whole team to do that, not just only me. We have many doctors, many mentors that help me to do the proteomic analysis and have gathering the people or the patients together. So this is like a big group that everyone are glad with this reward.
Okay, so finally, what you invested, have been very worthwhile, I would say. Okay, but for now it's time for short break again. We'll right back. We learn more on maybe question that you may have about hair problems or scalp problems, and also the future research, of doctor. So don't go away, and please stay tuned again on Be My Guest. So welcome back to Be My Guest, and I'm Sarosha Ratanapian. In this break, we are learning more about the future project of Ajahn in hair loss therapy. So what is your next research?
My next research is about the frontal fibrosing alopecia. Actually, this is new disease just known to Asian population. This disease usually occurs in a woman who has just passed the menopause. We call it postmenopausal woman. It's usually more than 50s, 55. This woman usually has band light of alopecia at the front. It is like a man that have receding the hair at the frontal hairline. But this disease is occur in women, in older women. This is not what we aging with their hair, that kind of hair. But this is the disease of inflammation that we have. There are many inflammation cells infiltrate underneath the scalp, and there make the hair become falling and then become scarring. So this kind of disease is very interesting because once you get the hair loss, even the doctor cannot get the hair come back.
Now, what about hair transplantation, which I believe that it's one of the very popular and famous treatments of hair loss. So could you tell us a bit, because you actually have graduated from implantation as well.
The hair restoration or hair transplantation are actually more popular because it is like lifelong treatment. The hair transplantation is the surgery that will remove the hair from the back that you have a lot of hairs, and then move it to the front or to the area that you have many hair. The principle of the disease is because the hair at the back has no receptor for the male hormone, so they're still healthy even you are very, very older. So after we move the hair from the back to the front, this transplanted hair usually stay for life. That is mean the transplanted hair will stay for you until the end of your life. That is the treatment that is quite lifelong when you compare to the topical or the oral medications. The process take usually many hours, usually 6 to 8 hours to get the whole process, starting from getting the hair from the back. Either you extract one by one, or either you get it with a strip, and then we make a hole at the front and get the new hair coming into the new area. So the whole process usually takes 6 to 8 hours, but After that, after the patient get these transplantations, you need to wait for at least 6 to 8 months so the hair to grow.
Okay, so what type of people who are suitable for
This
hair
is usually
transplantation?
where many indications. The most common indication is male pattern hair loss. That the male who has totally bald or no hair at all. These kind of patients usually not respond to oral or topical treatment because they have even no root underneath the scalp. So you need a new root coming from the back into the new area.
I see.
And the second patient is in to hide the scar. Some patients has burn. They have chemical burn. They have burn and they get the scar on the scalp. And they have no hair, so we can do the hair transplantation to help them. Some patient has burn on the eyebrows. And they have no eyebrows. And like they are stigmata for their life. Hair transplantation can help because we can transplant the eyebrows and eyelash also.
I see, on eyelashes too.
Yes.
I see. Okay, so wonderful.
So this is going to help the patient who totally no hair at that area and help to have the healthy hair. That's stay for life.
Okay, so people know about hair transplantation treatments. Some people have tried low laser therapy. Now, any other new treatments of hair, loss of hair restoration?
The new treatment is more toward the treatment of the disease that we call alopecia areata. The alopecia areata is the hair loss from the autoimmune disease that your immune cells that attack the hair follicles that make the hair falling. So we have new drugs that we call the JAK kinase inhibitor or JAK inhibitors. These JAK inhibitors, either topical one and oral one, that may help to treat the autoimmune disease. Before that, we use steroid that already everyone knows, the corticosteroid. They can inhibit the immune cells, but they can inhibit every immune cells. But the new JAK inhibitors that inhibit especially some type of immune cells that cause the disease. So that's more specifically. So the safety profile is higher. This is like more safety. So nowadays, many study is focused on this JAK inhibitor for the treatment of many type of hair loss.
Okay.
In Thailand, we have just only this drug for a couple years, so we are still catching up more patients and see the results.
Okay. So first of all, if you have hair problem, you should consult the doctor then because there are so many diseases that you mentioned.
Yes, I have many patients that before they come to me, sometimes they buy a lot of products from the market or from internet without without the proof that this kind of product work or not working. I think when the patients have the problem of hair loss, the better things that you have to come to see the doctor to check what kind of disease that you have, so the doctor can give you the proper and the correct treatment to the patients. Treatment earlier is the better because some patients come to see me it's too late to help them.
I see. Okay. So last question. So any final notes for our viewers of Be My Guest?
The final note is like if the patient have a problem with hair loss, like it says, the first thing that you have to come to see the doctor. When you see the doctor as early as possible, so the doctor can give you a correct diagnosis and the correct treatment to the patients.
Okay, so that's all the time we have for the interview today. Thank you very much for your time, your contribution to people who are facing a hair problem, I would say currently. So ขอบพระคุณค่ะ Androgenetic alopecia, the most common type, affects 50% of males over the age of 40 and 75% of females over 65. And with low-level laser therapy, men and women who lose confidence from their hair loss will find hopes again in having their hair regrow through a painless treatment. And that's all the time we have for Be My Guest this week. Thank you very much for watching us and tuning in. For more information, you can log into thainews.prd.go.th/en. And I'm Surosha Ratanapian. สวัสดีค่ะ